Well, what I'd like to do is start the discussion with the idea of the actual frail patient and how you, in your current setting, would identify someone as frail compared to any other of your geriatric patients.
So in the acute care setting, like most other settings, you don't always know coming in what the patient's baseline is. So you're really trying to find out more information about them, and is the baseline, or what you're seeing, is that they're normal status, and a lot of times it's not. But I think frailty is very complex, and for me, I think it's patients that are kind of on that balance of whether they're safe to live alone or not, and a lot of times they're not. And so in the hospital setting, you're dealing with having to assess those issues and find a safe discharge for patients like that.
All right.
So then considering what's changed recently about a person's health status and what impact that's had on their function, because something that wouldn't necessarily have a huge impact on a non-frail person, an infection or illness could have a huge impact on someone who was frail or tended toward being frail.
Mm-hmm. And I think in the home health setting, particularly with patients who have good family support, we see a lot of patients that are able to stay in their home, but then you get to the thin line between, well, how safe is safe, and is a family overcompensating, because then you begin to realize, well, maybe they really need more assistance or more medical care than what they can get in the home setting. So it's kind of a trade-off.
I would agree.
Yeah, when I worked in the hospital, I was always surprised. I would see people and be like, there's no way this person could be living alone. And then working in the clinic now and seeing patients coming in, I'm often surprised of the type of patient that is actually able to be moderately successful in the home that perhaps you might be very concerned about if you saw them in a different setting. So
Yeah. Well, I know, and the other thing that I tended to notice was, particularly with families where you would get the feedback, well, you know, their family members, they had fallen before, so this was not a new event, or something similar to this had happened before. But you'd hear the feedback, well, they're just not coming around like they did before, and it's taking longer for them to get well, and I'm not sure what the difference is, but there's something different this time compared to what's happened before. And I think for me that was always a trigger to say, well, there's probably something else going on systematically or physiologically that maybe we need to look into further.